Dr. Damji, at the Glaucoma 360 New Horizons Forum, you were part of the forum discussion regarding telemedicine. Could you outline your presentation at the panel discussion?
Right. You know, the model of teleglaucoma has evolved, and so my presentation was covering different aspects or different pathways or models, if you like, ranging from a remote telemedicine approach to an enhanced efficiency with digital integration into the office environment, where patients might come in, have a bunch of tests, but the physician is reading it and interpreting it in terms of virtual reality, and then somebody else gets back to the patient, etc., to improve access, efficiency, and so forth. And you know, there are other models too that we need to keep in mind. So is the purpose of the telemedicine just simply screening and detection of disease, or is it actually management? What if patients have a lot of data? They're taking pictures, or they have continuous intraocular pressure monitoring at one point from home. How can we get that data? So monitoring is another component as well. So I was just outlining thoughts and our practical experience in Alberta with teleglaucoma.
Okay. Now, telemedicine is a really hot topic right now. How do you see this evolving?
I think that the way it's going to evolve is we already know there's a cost benefit to looking after patients from a distance. If you look at the cost savings, patient has to travel less, you know, perhaps less anxiety about the encounter sometimes. They themselves seem to like it. The health system costs are less, right? The time with the physician may be less, etc. So we know there's a cost saving, but the transformative thing is going to be mobile health. We know that smartphones, wearable technology, etc. Will change the game, because it's a lot more cost effective now, rather than expensive cameras and visual field machines and clunky things that you have to put in the middle of nowhere to get information, you know, for patients. So I think it's going to transform the landscape, and we'll be able to set up mobile offices initially, and then one day patients themselves will be able to do the stuff at home and send it to us.
Now, you're up in Alberta, Canada. How is the concept working there as opposed to what's going on in the United States?
It's working well, and I think there's a number of reasons for that. First of all, my retina colleagues, Dr. Matt Tennant, Mark Grieve, a number of individuals have put together a company called Secure Diagnostic Imaging 15 years ago, and so I was able to leverage that for glaucoma purposes. And so we can take fantastic three-dimensional pictures of the optic nerve, for example, interpret it, and it's all a very secure web-based system that was already in place and utilized. Number two, there's a billing code available for interpretation of this information, and you know, using it for the benefit of the patient for diabetes, glaucoma, etc. And number three, you know, the medical legal environment is such that I'm okay if I have a practicing license in Alberta, seeing patients in Alberta. And also there's the fourth aspect is collaborative care. So when I started in Alberta about 9 years ago, we got together optometrists, ophthalmologists, technicians, nurses, and had a conversation about how we could work together in the patient's best interest. And so we have a well-defined collaborative care model, which puts the patient at the center, but also leverages each other's expertise in an appropriate way. Timely communication, secure platform, etc., etc., optimal utilization of finite resources. So that collaborative care model also, I think, was a catalyst for being able to move ahead with the kind of work we do.
The bottom line, in terms of the clinician in general, how excited should they be about this technology coming to the forefront?
I think it's a fantastic addition, because what it does is it enhances the ability for us to look after patients by giving them more efficient access, and uses our time and expertise more wisely. And it's a benefit in terms of cost, you know, savings for the health system, for the patient, for ourselves. So I think hopefully people are going to be very excited about it. And there's multiple things in terms of validation and cost-effective studies that need to be done to really show the value of it, you know. But I think it's coming, and I hope physicians embrace it. I would say that the ethics of the situation need to be thought through, and here's what I mean, is that the patient-physician relationship has been at the center of what we do, and I hope it'll always continue to be so. But with the telemedicine technologies, one could fragment that relationship if one is not careful. So as long as we're ethical and we do it for the right reasons, and we maintain the relationship with the patient through healthcare providers and make sure that the patients are well taken care of and our profession advances, I think we'll be okay. So I would think that the liability aspects, the professionalism, the ethics of it need to be thought through in parallel, so that as we adopt these things and think about care pathways, we do it thoughtfully rather than just finding out after the fact that it disrupted the patient-physician relationship.
Thank you, Ducky, for your time. We appreciate it.
Thanks very much.